So you're unsure if you have hip impingement, but you are getting some symptoms in the front or insides of your hips that are very pinching, very annoying, very aggravating. How can you be sure that you have hip impingement? Dr. Nicholas Mercer with You Improve PT. So, like you probably know if you've seen any of my other videos, I have a long history with hip impingement, FAI, labral tears, and non-surgical management of those issues. So one question I get a lot is, do I have hip impingement? How can I tell if I have hip impingement? So in physical therapy, there are a couple tests we can do to screen for hip impingement. But that doesn't mean that those tests, if they come back positive, mean that you have FAI or true, hip impingement. A lot of times, especially with the FADER test, where we take that femur into adduction and internal rotation, and we get either some pinching, some clunking, or replication of symptoms, yes, that it could be true that you have that femoral acetabular impingement, but if you have a positive test with that, so you're getting symptoms with that, that could also just mean that you're lacking those hip movements. So when we try to force you into them, it's not comfortable, right? So that's a good one to screen. So a lot of the times negatives are actually negatives, but it's not that, positives are always actually FAI or hip impingement. And kind of the same goes for labral tears. We have some tests that can confirm those, but it's less of confirming and more screening and kind of being able to treat those deficits in physical therapy versus actually being able to know, oh, do you have that deformity on your femur that's causing this, or is it just, or if you have a labral tear, are those truly causing this, or is it from something else, maybe arthritis or another condition? So obviously, the most accurate way to diagnose hip impingement, FAI, labral tears, is through imaging, X-rays, MRIs. X-rays, they'll usually, confirm that there's some deformities in the bone, and then MRIs can kind of confirm a little better labral tears. However, just because you have those issues in your hips, just because you have extra bone on your femur, and labral tearing doesn't mean that you necessarily need to have surgery. Particularly, you don't need to have surgery right away. So with FAI, just pure FAI, no labral tears, it's safe to say that we can manage that without surgery, because there have been several studies that show that physical therapy, conservative management can be very effective in treating FAI. Now with labral tears, it's a little different because labral tears can get really irritated and inflamed, and they can cause a lot of problems in the joint. So it kind of depends on the size of the labral tear, and a lot of factors go into that. But if long term you can keep that inflammation down, keep the irritation down, and get the hips moving like hips should, get that labrum, if potentially it's torn, to not be inflamed, and manage your movement stronger, more flexible, get the joint more mobile, it can be kind of more of a nuisance than an actual thing that irritates your hip all the time, right? So for instance, my left hip, I've got a labral tear in it. Every once in a while it'll click, but it doesn't cause pain, and I know what movements I need to do to make it click less. And so that's from a personal note, that's anecdotal, that's what I'm dealing with right now. But it doesn't interfere with anything. I can do all my splits, I can squat, all of this without pain. So kind of the point of saying all of this is, if you're having hip impingement symptoms, chances are you either have a movement deficit or something's going on with the tissues in your hips, right? If it's just a movement deficit, that is something that can pretty easily be solved with physical therapy, the proper conservative treatment, and basically hard work, knowing what you need to do, working hard at getting those movements back, getting the strength back, getting the flexibility, and being able to manage those symptoms. And however, if you have those structural issues, it can be kind of a toss-up, and it depends on how you want to go about it. So I'm not going to lie to you and say that surgery is stupid and it's not useful and it's unnecessary for all cases, because that's not true. There are several studies that show that, at least in the short term and in the kind of moderate term, that surgery for FAI and labral tears have better outcomes than just PT conservative treatment alone. Now, some of those studies only take, I believe one of those studies only had them doing 8 physical therapy treatment sessions over the span of 6 months, which any good or decent PT would tell you that's not nearly enough to see good results. That's beyond the point. So sometimes the surgery can be very effective. However, we want to make that a last resort. So a lot of these studies also have them go through a conservative treatment as well. And a lot of times conservative treatment is as good or marginally, maybe like a little bit less effective than surgery and PT. But we also want to weigh the detrimental parts of surgery. So when you have surgery, your tissues are never the same. Even if it's arthroscopic, they still have to go through soft tissue, and the way soft tissue heals, it doesn't heal the same as it was before. You'll always have scar tissue there, and you will always have that scar tissue built up in those hips, making it harder for you to get them flexible and stronger and more mobile. But that doesn't mean that that surgery might not be necessary. So this is kind of the difficult part where we want to weigh your options. Do we want to go through surgery and immediately without trying PT conservative treatment from a good physical therapist or other healthcare practitioner who really knows your deficits and what you're going through and how to make hips work like hips? Or do we want to just assume the surgeon is right without trying more conservative approaches that won't interfere with the healing of your tissues, with the quality of your tissues, and try to get that immediate relief from surgery, which won't come because it takes a while to recover from surgery. But I am lucky to be kind of on both sides of that spectrum, where I was the person who went and got surgery because the surgeon told me to, didn't try physical therapy because I didn't know any better. I was told I needed surgery, so I went to have surgery. And for my case personally, I was not seeing a PT after, or anyone after, who knew how to treat an FAI hip, right? An FAI labral tear hip. And what that actually led to was more hip pain than I had when I started. And I went back, got x-rays, got MRIs, and I was told I still had FAI and I had new labral tears and that I needed surgery again. And that is when I decided to go a more conservative management approach. And the conservative management helped me a lot. Of course, I had to kind of compile information from a lot of different resources to find out what worked for my hips. But what we got was conservative treatment, me managing my movement, making my hips work like hips again, had a better effect for me personally than the surgery did on its own. Now, do I know that if I had just gone conservative before the surgery, would I have needed the surgery? Unfortunately, I don't know, because I got the surgery first. But the fact that I continue to have FAI and labral tears not surgically fixed, so I have them now, but I hardly feel any symptoms from it. I maybe get a little pain one day every month. That is far and away better for me than the surgical option was. So again, that is anecdotal. That is just for me personally, but I've seen this from anecdotally from a lot of different people, read people's stories, looked at other research, and it kind of comes down to what are you willing to put in and what are you willing to suffer with. Now, if a labral tear, FAI, is severe enough, you get some osteoarthritic changes, and it's just causing you so much pain because it's so messed up in your hips, maybe the surgical approach, once you've tried physical therapy, really good conservative management, surgical approach may be necessary for you. However, that doesn't mean that that's what we should be jumping to, right? So as far as knowing if you have FAI or labral tears, Best way to find that out is through a MRI, X-ray. But more importantly, is that going to interfere with your treatment options? I would say, regardless of whether you have true FAI labral tears versus the symptoms of hip impingement, the first thing you should be trying is conservative treatment, because that's non-invasive. You're not going to have long-term effects from it. You may get a little irritation from the exercises, from certain exercises, depending on what's the specific problem with your hips. But we're not messing with your tissues to an extent that is irreversible. Surgery is. Again, surgery isn't bad. I don't say anything is really bad or good. It's necessary or unnecessary, appropriate or inappropriate. If you haven't gone through a physical therapy conservative treatment approach, and that conservative treatment approach occasionally includes cortisone steroids, things where we're not doing intense surgery and changing the actual anatomy of your hips. After going through that, you're still having hip pain, that surgical approach, that may be what does it for you. But, it's kind of informing our decision for treatment. So, long story short, we could test to try to figure out if you have FAI or labral tears. If you want that information, you can definitely get it through x-rays, MRIs, and kind of these screening tests from physical therapy. However, I would also say that you shouldn't worry too much about knowing if you have this right away. That shouldn't be your first step. Your first step should be seeking out a good physical therapist, a good movement specialist, having them assess your movement deficits. So testing your weaknesses, your strengths, your flexibility, your joint range of motion, your joint quality, your endurance, all of these other measures that we can fix conservatively, get those resolved, and then if you're still having these symptoms, that is when we really need to find those answers for the hip. Not to say that it's bad to get those answers early, but if it was me and I was trying to get down to what's going to help me most, go for that PT conservative treatment. Now, the unfortunate part is a lot of PTs don't have a lot of experience treating hip impingement, FAI labral tears, and they personally haven't gone through it, so they don't really know what it feels like. They're not really as well equipped to treat it. And our tests as physical therapists really focus on the movement system, which is a lot more important as far as the hips working like hips should work is concerned, compared to x-rays, MRIs, which don't look at movement, they look at a stationary picture. Now, I am soon going to be introducing a program to help manage hip impingement through self-tests that a PT would use, and kind of compiling all of this into a very relevant, partially specialized program for people suffering from hip impingement. So taking all the skills I have as a PT, the tests I would use on someone who is experiencing symptoms of hip impingement, and applying them to find your deficits and give you the exercises and techniques that are most likely to help you. There's so many tests in this program and even more exercises and techniques to help get your hips working like hips again. And it's really focused on what do we normally see in patients with hip impingement and how can we best treat them to reduce those deficits and get those symptoms controlled. And I thoroughly believe this is going to be a huge beneficial tool for anyone suffering from hip impingement, because obviously I have a lot of experience with it. I have fixed myself and helped others with hip impingement, and I've kind of compiled everything I've learned to narrow down people's deficits and what really is going on with that movement system in patients with hip impingement. So that is going to be released pretty soon. So if you are suffering from hip impingement and you want to get answers now and you want to start working on it now, that program is definitely for you. Again, it's based on physical therapy. It wouldn't be necessarily physical therapy treatment or thorough evaluation, but it has all the tools that I would give to someone who was suffering from hip impingement. If they were standing right in front of me and I had not done any tests on them, I would feel very confident giving them this program, talking to them again in a couple months, and expecting to see those symptoms improving over time and then managing those symptoms throughout the life. So if you have any questions about what this program is going to entail, or if you have if you're interested in getting one of these programs, go to youimprovept.com, send us an email, let us know you're interested, and we can give you more information on that. Otherwise, go explore our YouTube channel. We've got videos on hip impingement and any other type of pain that you may be having. And I hope this gives you a lot of answers, especially if you're really concerned and worried and anxious about if you have FAI and labral tears. Just know, just because you're having those symptoms doesn't mean that you need surgery, right? It doesn't mean that you need to go through this whole lengthy process to figure out what's wrong with what's going on inside your hips. You don't need that yet, okay? So check out our videos on YouTube for hip impingement. Reach out to us through youimprovept.com. We would love to hear from you, hear your story, and see how we can help you get back to your active life. So get ready to improve your pain, improve your movement, and improve your life.